Hello, good morning everyone. Today we are going to talk about Mulligan techniques application in lumbalgia.
The Mulligan concept is a manual therapy approach developed by New Zealand physiotherapist Brian Mulligan. It combines joint mobilization performed by the therapy with an active movement performed at the patient. The main goal is to reduce pain and restore normal.
Today we are going to explain the main principle of the Mulligan concept. The first principle is that movement must be pain-free. This means that the patient should not feel pain while performing the movement. The second principle is a sustained accessory glide is applied. The therapists maintain a specific joint glide while the patients perform the movement. The third principle is the patient actively participates in the movement. The patient performs the movement while the therapist applies the manual technique. Another important principle is that immediate improvement in pain or range of motion is expected. If the technique is effective, the patient should notice an improvement during or immediately after the technique. Finally, if pains occur, the technique should be modified or discontinued. The movement should always remain comfortable and pain-free.
I'm going to talk to you about mobilization with movement. MWM is the most commonly used Mulligan technique. The therapist applies a joint glide while the patient performs the restricted movement. Examples: knee improve painful flexion or extension, shoulder increase elevation or abduction, ankle improves dorsiflexion, cervical spine improve rotation.
Play to cervical and thoracic spine. The involved oscillatory modulations, the improved joint flexions objectives. Reduce pain, improve mobility, and cervical stiffness.
Snacks. Sustained natural apophyseal glides. Snacks involve maintaining a sustained glide while a patient performs an active movement. Indications: neck pain, cervicohand hedge, limited cervical rotation, and low back pain.
Now I'm going to explain the pain release phenomenon, also known as PRP. PRP consists of positioning a joint in a specific way to achieve rapid pain relief. The therapist places the joint in a particular position that helps reduce the patient's pain quickly. PRP is commonly applied to the interphalangeal joints, the wrist, and the shoulder.
Extremity techniques. These techniques are applied to the shoulder, elbow, wrist, hip, knee, and ankle. Their purpose is to correct minor positional faults that may cause pain or movement limitations.
General indications Mulligan techniques. And commonly used for mechanical pain, neck pain, low back pain, painful shoulder, lateral epicondylia, ankle sprains, patellofemoral pain, syndrome mobility restrictions.
Indications: Mulligan techniques should not be used in cases of recent fractures, bones, tumors, joint infections, severe instability, serious neurological compression, severe osteoporosis, and acute inflammatory arthritis.
Advantages of Mulligan techniques. First, say they can produce immediate improvement in a movement. Second, they can provide a rapid and reduction. Another advantage is active patient participation. The patients help by the performing the movement. Mulligan technique can be combined with therapeutic exercise. Finally, they have high clinical applicability, which means they can be used in many different clinical situations.
Low back pain lumbalgia. Low back pain is defined as pain located in the lumbar region. It may be associated with stiffness, functional limitations, and decreased range of motion. The Mulligan concept is frequently used in patients with mechanical low back pain to reduce pain and improve mobility through pain-free mobilization techniques.
rationale for low back pain treatment. According to the Mulligan concept, the function in vertebral joints may have movement restrictions. By applying accessory clay, the patient performs an activity movement. The therapist and the correct this patient restore normal movement, improve function, reduce pain.
Lumbar snacks. Lumbar snacks are the most commonly used Mulligan technique for low back pain. The therapist applies sustained pressure to the affected lumbar vertebra. The patient performs active movements such as flexion, extension, or side bending.
Lumbar snacks, goals, and benefits. Reduce low back pain, increase range of motion, improve physical function, and benefits immediate pain relief and reduce functional disability.
Lumbar mobilization with movement is used when specific lumbar movements provoke pain. Procedure: the therapist applies a specific accessory mobilization. The patient performs the painful movement. The movement must remain pain-free. Implications: painful lumbar flexion, limited lumbar extension, pain when bending forward or standing up.
In the cervical thoracic spine, it can also be applied to select lumbar segments. Objectives: real segmental, decrease mechanical pain, and therapeutic exercise.
Physiological effects in low back pain. Mulligan techniques might produce several physiologic effects, including stimulation of joints mechanoreceptors, reduction in pain perception, improved neuromuscular control, normalization of vertebral movement, and increased patient confidence during movement.
Indications for low back pain. Mulligan techniques may be indicated in mechanical low pain, non-specific low back pain, pain during flexion or extension.